far as doing blocks with ultrasound, regional anesthesia with ultrasound, it greatly increases your confidence. I'm Dr. Greg Hickman. I'm the medical director and anesthesia director at the Andrews Institute in Gulf Breeze, Florida. I am a regional anesthesiologist. I've been doing regional anesthesia for 32 years. Our practice is an outpatient surgery center, which is primarily orthopedics and sports medicine driven. Our cases are 80% orthopedics, and so we do a lot of regional blocks. As far as doing blocks with ultrasound, regional anesthesia with ultrasound, it greatly increases your confidence. It improves your speed of being able to do the block quicker, and it actually improves the duration of block because you're getting more local around the nerve, the target nerve, versus doing it blind where you really don't see it. So it should help anyone's confidence in what they're doing to be able to see what they're doing. And that's one of the beauties of ultrasound. That's when I knew early on it was going to be fantastic. Clarius ultrasound helps you improve your block success and block duration, giving your patient comfort for longer. So they're more comfortable. They go home, I tell them they're not gonna have any pain that day. They shouldn't need any narcotics the first day. And a lot of our program here is based on doing long-term regional anesthetics to decrease patients' exposure to narcotics. We wanna decrease the amount they're taking, we wanna decrease the amount of exposure they have, and decrease the risk for addiction and all the side effects. I use the linear Clarius probe. The presets are for nerve blocks, and it's very specific. It works really well. They have got their programs down just right, so you can see the nerves, you can see the muscles, you see the things we need to see. And Clarius is very good at seeing the fascial layers around the muscles, because oftentimes you're popping through that, and then you're in the area where the nerve's running, and that's where you deposit your local anesthetic. It is very beneficial in my practice now because of the mobility. I have to move. We were doing a block sometimes in the pre-op area. I got to run to the OR and do something. I got to run to the PACU and do a block. I run over to PT and check a continuous catheter, make sure it's working. And to be able to have that mobility with the Clarius and the quick connectivity, it really adds to the practice now. And I'm sure everybody's practice is getting bigger. Most practices, I'm sure, are doing more and more blocks and more locations, and they have to be mobile and be able to get there and set up quickly and get them done. With the version 3 of Clarius, I can easily talk to my compadres and colleagues and explain to them the beauty and the mobility and the image. The image now, the image quality is so that there's no reason that you couldn't use this in your practice every day. The Clarius system works so well and is improved so much. It's as good as anything else. And the cost is going to be much less than your typical laptop pole-mounted ultrasounds out there. And that's a big benefit too, especially guys that are practicing in physician-only practices where they're doing their blocks and they want to be able to have that ultrasound right in their pocket. They can literally do that and walk around with this machine. The beauty of that is fantastic. The Clarius is very simple, very easy to use, and it's very straightforward. If you want to increase the depth, you just go to your iPad screen and take your finger and swipe up. If you want to decrease the depth, you just swipe down, and then you don't have to fight all the buttons on the bigger machines. You don't have 50 knobs to have to figure out which one to slide or move or turn. You just put your finger on the iPad and make your move. You also do the gain that way, just sliding right and left, increasing, decreasing the gain. It's really sweet, and it works really well.